Rett syndrome is a rare disease affecting about 1 in 10,000 people, and it's caused by mutation in the gene MECP2, which is found on the X chromosome. Males die shortly after birth since they only have one X chromosome and therefore don't have a functioning copy of the gene, but females do much better. Why? Because each cell in females inactivates one of the X chromosomes at random, so half the cells will only express a normal copy of the gene, which are the yellow ones here, and half will express only the mutant copy, which are the red ones. That's not great, but it's a lot better than all the cells only having the mutant version, which is the case in the males, since they only have one X chromosome and it has the mutant copy of the gene. What is this inheritance pattern called? That would be X-linked dominant, since even one copy is enough to produce symptoms in a heterozygous individual. Virtually all cases of Rett syndrome are caused by a new, sporadic mutation in the affected individual. In other words, the parents are not carriers, and you won't be able to detect anything abnormal if you do genetic testing on the parents. Alright, so what does this gene MECP2 do, and what kind of disease do you get when it's mutated? Well, MECP2 stands for methyl CpG binding protein 2, and the MECP2 protein regulates the transcription of a variety of other genes into mRNA. This gene is expressed all over the body, but it's most important in the central nervous system, where it regulates genes involved in development of the brain. So how is a patient with a mutation in MECP2, which is called Rett syndrome, going to present? Well, the pregnancy will be normal, and for the first few months of life, the baby will seem just like any other. But starting as early as 3 months, the first thing a pediatrician might notice is that the baby's head is not growing enough proportional to the rest of its body. The brain will actually stop growing entirely by around age 4, so as they get older, their head will seem smaller proportional to the rest of their body, although not by as much as you might think, since a 4-year-old's head is already close to as big as an adult's. Later in infancy and in childhood, patients with Rett syndrome will lose the ability to speak, develop gait abnormalities, and develop stereotyped hand-wringing motions, which is probably the most specific feature for Rett syndrome on your boards. If a question mentions hand-wringing in a young girl, you should immediately think of Rett syndrome until you have significant evidence to the contrary. Patients can also develop a variety of other neurologic problems, such as sleep disturbances, seizures, autistic features, and breathing abnormalities, and many will also have extrapyramidal motor symptoms, like the ones you learn about in psychiatry. Do you remember what those are? In Rett syndrome, you might see oculogyrate crisis, rigidity, or drooling. Lastly, they also often have poor bone mineralization and can have fractures, and more than half will develop scoliosis. Life expectancy is about 40 years old, and they often die from seizures or cardiac arrhythmias.